Well, there's a change when it comes to health insurance. There will be a move right across the UAE for compulsory health insurance, but this could also create some new opportunities. To get more details on this, we are joined by not just an expert, he's a legend of the insurance industry from Sukoon Insurance, Danish Kazi. Thank you for coming in to Talk 100.3.
Thank you. Kindly.
Well, this is an interesting one because we know the laws changed back in 2013 where the legislation in Dubai made it that health insurance was compulsory for every resident in the emirate and generally was the employer that had to pay it. But now there's got to be compulsory health insurance. Does that mean if you're a freelancer or you're here on a holiday, you also need to have health insurance?
So basically, first, what we need to understand is that the country is moving towards an advanced stage where they would want most of the people living here to be protected. And
Right.
we have learned from what we have seen during COVID times, pandemic, where people did not had insurance, were in turmoil, and it's very important that to have you covered. Now, to answer you specifically your question, that this kind of plans would only mostly cover people who are residents of the country.
Okay.
And earlier, these compulsions were mostly focused on two emirates, which is Dubai and Abu Dhabi.
Right.
And then these will be then extended to other emirates now. And actually, what we are being told that this has to be done by the first quarter of 2023, where all the employers in those respective emirates will also have to arrange insurance for their staff and employees or the sponsors before that date, so to avail labour permits or visas in those emirates.
Well, what has been the response from the business sector? Because this is certainly going to be a big added cost to a lot of businesses.
See, initially when this came in Dubai and Abu Dhabi, yes, of course, there was an impact. Cost of acquisition of employees, cost of maintaining those employees would have gone up. But now, as mostly if you see, the two big emirates have accommodated those costs in their budgets and expenses. And I'm sure there would be a slight pressure in the beginning. But what the employers will realize that by doing so, they're just improving the productivity, they're improving the retention, they're sticking onto their employees. Because if your employee leaves because of not having these services, it costs you more to replace or retain those kind of employees. So it's always a big asset for you to retain your employees, plus keep in check on other things. Like, for example, health insurance. If you have a proper program in place, you can avoid those sick leaves and all those things. So I think it's going to benefit the economy, benefit the employers as well in the long run. It's not going to be a big impact on the expenses, and the outcome of that would be much beneficial. That will just increase productivity for them as well.
Well, I think that's the mindset of this is an investment in your staff, that a happy worker is a more efficient worker.
There you go.
Healthier worker is you're not going to have staff taking extended periods because they've got a respiratory infection or a bad back if they're getting the adequate care.
There you go.
So I can understand that. But when it comes down to what is going to be compulsory health insurance, that is there going to be sort of obviously a minimum basic across all the emirates that they're going to have to enforce?
Yes, so currently as well, basically what happens is a basic plan where you pay anywhere between 600 to 700 dirhams per person if there is no other issues. On a normal person who's below 60 years of age, a young person. And then what you get access to certain hospitals, and especially you get some access to emergency treatments.
Okay.
But of course, there is always a provision that in case you need to be seen by a specialist, there's a procedure to do that to a certain number of hospitals. And when you say insurance works, the plans you have, it depends on which kind of network of hospitals you want to access. It depends on that. In this situation, mostly what will happen is that there will be small number of hospitals where you can access, and where people will see value in this. And we try to buy upgrade plans as well.
Is the healthcare, that basic healthcare, going to be the same across each emirate, or could you see slight changes with the legislation in each emirate?
I think eventually all the healthcare provision is quite similar, but they're trying to. I'm sure with this coming in, DHA and other authorities will work together to bring it at the same level across all emirates. And but generally, what you'd see is that if someone is protected or based out of Sharjah, may not be coming to Dubai for all those treatments. It becomes very expensive. So I'm sure there is some investment and work going on in that direction as well, as health insurance becomes compulsory for the.
The pandemic, the COVID-19 pandemic, affected a lot of sectors dramatically.
Yes.
But it also affected insurance, whether it was workplace insurance or cost of living, whatever the insurance was. How did it affect the healthcare industry? Has the industry really struggled in result of the pandemic?
Well, of course, there was a lot of pressure on the insurance companies at the time, but a lot of subsidies, as we know. The exact figure is not available to anyone, to be honest.
Of course.
But the impact was that, if you see when the pandemic began, there was a lot of pressure on the government to absorb those costs, providing those healthcare facilities, arranging all those capacities and all that. So similarly, insurance companies also took some brunt on that, and that is why probably the realization is coming from, because the government is realizing that it's more important that the employers also take some responsibility of the staff, so that tomorrow these guys are protected when something happens. As you would know, that pandemics are such not over, actually. It's still happening, and we still see these alerts happening in US, in China, in India recently. So it's better to be protected before that happens again, unfortunately, but not hopefully to that level. But at least you should have some kind of respite in case it touches you again in the near future.
I think so. I think that things like long COVID are certainly affecting a lot of people that may not get reported, or hard to actually diagnose, who aren't unaware of what it is. But when it comes down to this, what I like about this, and we were speaking about this a bit off air, is that a lot of the wealthiest countries, the Western countries, have universal health care. You look at certainly Western Europe, you look at where I'm from in Australia, and we often look at the United States of America as one of the leading nations in the world, and their healthcare is almost an embarrassment compared to other leading nations. And that's them saying it sometimes, and not me. Do you think this is also part of that step for the UAE to come into line with other leading nations to have the universal healthcare?
See, UAE has already created a mark globally as one of the leading nations with all the initiatives they've taken. Today, you go around, you see the infrastructure, the financial opportunity, the quality of living has gone up. So if you see it, this is part of that strategy, in my opinion, to give the quality healthcare to the people as well. And yes, you are right that if you see the biggest dispute every time in US, politics is about healthcare bills.
Yeah, it is. Always is.
We have been hearing this since Obama was in the power. Yeah. And now what they're trying to do here is, of course, they're trying to make it accessible to people, because sometimes what people used to do, they were without healthcare, and then they were sometimes burdened to themselves and burdened to the economy as well. And like I said, that they need to regionalize as well, because it gives better control on if you see, insurance works on numbers, economies of scale. If everyone would have it, for us from the risk perspective, the probability is that we don't end up only insuring those people who are about to get a claim. So we would have a pool of people who may claim, who may not claim. That will also help eventually in the long run the risk rates or the loss ratios in insurance policy. Mostly what we see, if it's not compulsory, you only see people coming in with some problems who want to buy a policy, which puts pressure on our loss ratios as well. But if everyone has to buy it, then we are evenly taking a risk on each customer, where probably, I'm not saying anything, but probably it may help improve the loss ratios, where the insurance companies can sustain their pricing for some short or long term as well.
Yeah, no, that does make total sense. But the change in this, I think also, how does it affect sort of an incentive for retirees?
Yes.
Does this change? Because the policy was always, once you hit 60, you're back to your own country. Give or take was sort of roughly the initial plan. But now we're seeing, the 10-year golden visa, and people that can come here and start businesses and retire here. Does this make it a more attractive place for retirees in their 60s and 70s to come?
Rightly. See, what was problem is that before, like I said, insurance was selective. So people, even who were retirees, who were living beyond, were not sure once they are going to get the insurance. And insurance companies may not be like to taking them on board. And it could become so expensive that they may not be able to afford it. But now this new extension of visas and golden visas and all that, if every retiree would have to take a policy, then we as an insurance company would have a better pool to look at and evenly distribute the risk amongst all the people. Otherwise, earlier, only those people were stepping up who have some problem, and they would just want to have an insurance policy to protect that.
Yes.
Which means that only most of the customers you would be having would be eventually claiming from us. But if it's evenly out for everyone, like I said earlier, it reduces my risk as well. Plus, it gives me a better option to give better products on the table as an insurance company to my customers, including the retirees and people who have crossed that 60, 65 years of age. It's not that it was not available earlier, but it sometimes becomes so expensive for them, because people were being selective when they were taking those policies.
We're seeing a change of employers, and I hear from a lot of people, like, for example, the big issue is dental's not being included in basic as often as it was in previous years. I think it's also because Dubai is such a more of an attractive country. People aren't looking at those sort of those when they're looking at a contract. It's those lists of demands aren't there like they would have been previously. In the health insurance industry, certainly in this country, How are the needs changing over time? Are there certain aspects that needed to be covered that didn't pay? Is mental health going to be something that the next 10 years could be a pressing issue within the health insurance industry?
Yeah, before I come to the dental part, see,
Yeah.
the problem is that insurance would like to protect you for unforeseen events.
Yeah.
Dental is something, as we were having a chat offline, that people would want to have some cosmetic work done on them as well.
You always try and have it sneak under the...
Exactly. And how would you classify this? It's not that insurance companies do not cover dental. Sometimes it's limited or restricted, but mostly they're for emergency purposes, right? For example, if you have a cavity and all those things, it depends on that. Coming to a mental health awareness, yes, that is something which is gradually coming in, and we would see that, I'm sure, as more and more doctors available in this country to give that kind of advice, you would see more and more of that services coming in. You would see also that UAE is also becoming one of the top nations when it comes to medical tourism as well.
Yes.
So I think this market is moving in that direction where more talent would come in, more doctors would come in, and would give an opportunity to protect all kind of diseases eventually. If we have access to those doctors, eventually we would like to cover and protect your customers as well.
Yes, of
That's
course.
what our strategy would be.
And of course, then it comes down to the economies of scale. If you have more of
There
those
you go.
doctors available,
Yes.
then it can be a more attractive option for employers to include that for staff.
Plus a cost of a checkup, because if there are few doctors, then they will charge you high,
Yeah.
and it will kill your policy. And if there are many doctors, then of course the cost of per treatment will also be reduced. Like for example, same flu treatment can be differently priced at different level of hospitals. But then, of course, that kills your policy and that puts some impact on your loss ratio, which creates a loading factor for the next year renewal as well.
Dinesh, this policy of compulsory health insurance, how likely do you think it is to be moved across other countries in the GCC? We know that sometimes the UAE is sometimes other countries look at this country as almost an experiment. How likely do you think it is to roll out amongst the wider GCC?
Eventually it will happen, but I think a lot of work would need to be done. UAE has created an infrastructure. You have centralized, you have invested heavily in fin technology. So you have localized and indigenously built a lot of solutions. I'm sure that would be the right way to do, but I think UAE has taken the leap in that. It's a leapfrog effect, and I'm sure they will have that advantage over the next couple of years at least before other countries start adopting it in the same manner as they have done it.
No, I think you're exactly right there. I've got older parents. My father's 80, and one of the reasons he enjoys holidaying here is that he feels comfortable that if he falls sick or something goes wrong, the quality of the healthcare is so good that it's not going to be a problem. And I think that more and more people are going to be thinking the same way when it comes to holidays or retiring because of the level of healthcare. We've been speaking about the UAE's move to compulsory health insurance, which is going to create a lot more opportunities. Our guest this afternoon has been Danish Kazi, the insurance industry expert from Sukoon Insurance. You can see the website. It's Sukoon, SUKOON.com. Thank you very much for coming in and giving us an insight into the health insurance sector.
Thank you, sir. Thank you.